In this class, we will discuss regarding the strategies of reducing recurrence in pterygium surgeries and the adjuvant treatment of pterygium with the help of antimetabolites and the complications of using these antimetabolites, the overall complications of pterygium surgeries, which are intra and post-op complications. Okay. So the strategies to reduce recurrence by Shepherd et al. What they have said is that you have to use topical steroids prior to and following the surgery, oral doxycycline or topical azithromycin. Okay, so why doxycycline? Because it has, along with that it is an antibiotic, it has non-antimicrobial effects. So what are these other effects? So these effects are, it has anti-inflammatory, anti-collagenase, properties. It has meibomian, lipid, viscosity reduction effect. It stabilizes the vascularity, and it has anti-matrix metalloprotease 9 effect. So as we have read in the pathology, these are positive for matrix metalloprotease, this pterygium. So that's why. So it has anti-MMP 9 properties. So that's why useful. So it can be sorry for the disturbance. We have subconjunctival, antifibrotic agents, like dexamethasone, triamcinolone, and antimetabolites. So we will discuss regarding antimetabolites in detail in a while. He has also described a cocktail regimen in which there is 0.1 cc of 5-fluoro uracil, 0.3 cc of dexamethasone plus 0.1 cc lidocaine T-gauze needle, and it is inserted into the recurrent site. Okay. Then we have subconjunctival anti-vegfs, that is bevacizumab is given subconjunctival or topical bevacizumab drops 1% freshly prepared. Then we have this topical photosensitizer followed by argon laser photocoagulation. So topical photosensitizer like sodium fluorescin is taken. So this is applied. After that it obliterates the conjunctival facial vessels or the corneal vessels. Coming to the adjuvant treatment. So we can use beta irradiation. So these 5 were the strategies of reducing recurrence by Shepherd et al. Now we are discussing regarding the adjuvant treatment. So in this we have beta irradiation of glare sclera. Then we can use antimetabolites. So what are these antimetabolites? So what do these do? So they inhibit the DNA synthesis. This is a common mechanism of action. So in that way it reduces the fibroblast proliferation. So what are the antimetabolites? Mitomycin C, daunorubicin, 5-fluoro uracil, thiotepa. So regarding mitomycin C, it can be either given intraoperatively. So intraoperatively it is commonly used dosage 0.2 mg per ml for 3 minutes. Or topical drops 0.4 mg per ml times a day. So topical drops can also be either 0.2 or 0.4 mg per day. So what are the side effects with these? So there is pain, watering, hemosis, hyperemia, okay, secondary glaucoma, corneal melt, and perforation, and scleral calcification, microbial infection, poor epithelial healing, explicates. So these are the side effects of these antimetabolites. So we have to use them meticulously, and also that post after using we have to irrigate the area with a normal saline at least for 1 to 2 minutes. Now coming to daunorubicin, it is used intra of 0.02% for 3 minutes. So the side effects with this are same like chemosis and delayed epithelialization. Coming to 5-fluoro uracil, it is required in very high doses, so it has more side effects. Then thiotepa, it was used, but it has the side effect of irreversible depigmentation of eyelid. That's why it is not used. Okay, so this was regarding the adjuvant treatment. We have discussed mitomycin C, daunorubicin, 5-fluorouracil and thiotepa, and beta irradiation. Okay, now coming to the complications of pterygium surgery. So we can divide it into intra-operative, immediate post-op, and late post-op. Okay, so coming to the intraoperative complications, there is chances of bleeding, inverted graft, this graft, or buttonholing, or the extraocular muscle, that is the medial rectus damage. Okay, so these are the intraoperative complications, and the immediate postoperative is chemosis, graft, there is edema or hematoma, loss of graft if it is not sutured properly, infection of the graft. Then coming to the late post-op complications, is recurrence, limbal stem cell deficiency, graft retraction, or graft necrosis. So in case of graft retraction, there is strabismus and also diplopia. And in bare sclera we can have scleral melt and pyogenic granuloma. So this was regarding the complications of pterygium surgery. So with this we complete the topic pterygium. Thank you for watching.